Dear students, today we'll be learning about the anterior thigh. An anterior thigh, if you see within your lower limb, the front part of the thigh, and you are looking at a group of muscles which are located anteriorly, we'll be talking about these muscles. We have talked about already about the femur and the hip bone, and for those reviews, you need to be recheck with the recording of my hip joint presentation. So now, what are my objectives for today? We'll be learning about the muscles who are located within this compartment, and then we'll be reviewing the femoral triangle, a very important area for so many clinical correlations. And then in the last, we'll be talking about the nerves and vessels who are present in my anterior compartment of the thigh. So now I'll start with, as usual, with a cross section, and that is taken at the mid thigh level. And now you can see this. Keep on building it. We have talked about it already. We are looking at the long saphenous vein. This is a superficial vein. And then there's the deep fascia. And in between my deep fascia and superficial fascia, we have a membranous layer and a fatty layer. These are the components of my superficial fascia. And within this fatty layer, we have these superficial veins. And now we are looking at the deep fascia. And the deep fascia in the thigh is named as fascia latae. And then you can see laterally there's a thickening which is evident within this deep fascia. What is this? This thickening is given a name, and we call it iliotibial tract. It's a kind of a band, and it has a high clinical and functional correlation. We'll be talking about this shortly. And then the only one bone, like my arm, in the thigh, but the bone here is the femur because this is the femoral region. And then there are intermuscular septors which divides my thigh into three compartments, and these compartments are the anterior, then we have a medial and a posterior compartment. And right now I'll be emphasizing more on the anterior compartment. The muscle groups who are located within my anterior compartment, primarily their primary job is they have to bring extension at the hip joint. This is their number one function. There are other functions for some of the muscles which are included within this compartment, but the primary function is the extension at the knee joint. That's the prime job. And we can see that the knee extensors, hip flexor, it's a very, it's not a major activity at the moment here, because the hip flexion is primarily is carried by my iliopsoas muscles. But the extension of the knee is primarily the job of my quadriceps, and these are the prime. And the nerve who controls this compartment, and that's my femoral nerve. And then the medial compartment, what is the job of these muscles? They are the adductors. Adductors of what? Hip. We have to be, when we talk of an action, we have to be remembering which joint we are talking. And then the nerve who controls this is the obturator. And then the posterior compartment, primarily they are opposite of my anterior compartment. So they are my anterior compartment, their prime job was extension at the knee. So my posterior compartment are flexors at the knee. This is their prime job, and the other jobs are being assisted, being shared by others. But the primary extensor of my hip is my gluteus maximus, and then it's been added by my hamstring group of muscles. And the nerve who control this compartment, primarily tibial part of the sciatic nerve. There is a contribution from common fibular part of the sciatic nerve as well to one part of a muscle. Now let's review it again. These muscles are extensors of the knee. Primarily one muscle is responsible for hip flexion, and they are innervated by the femoral nerve. We are looking at this group. Now what are we seeing? One strap like muscle, this is my sartorius, and then we can see this bunch of muscles which are located in the front part, primarily making the bulk of my thigh. These are four muscles, and they are my quadriceps muscles. So this is my sartorius, and this one which is in the middle, a straight muscle, that's why we call it rectus femoris. Rectus means straight, and femoris indicates its location, a straight muscle who's located in my thigh. And then this rectus femoris has been removed, and what we can see underneath, we had a muscle called vastus intermedius. And on both the sides of this vastus intermedius, we had vastus lateralis and vastus medialis. I hope we are clear. So now this is 1, 2, 3, and 4. These 4 muscles are my quadriceps. Quadra means 4, a bunch of 4 muscles, and their primary job is to bring extension at my extension at my knee joint. And then if we tap at the tendon, what tendon is this? This is not quadricep tendon. This is patellar tendon. When we tap here, we are looking for the integrity of the spinal cord levels L2, 3, and 4. These are tested. In different places you find L3 and L4, L2, 3, and 4. It's all acceptable. Now let's look at these muscles individually. So right now we are looking at a muscle which starts its journey from anterior superior iliac spine and coming to the medial side of my upper tibia. Who's that muscle? That's my sartorius muscle. So you always ask what is difference between. So I'm showing you the proximal attachment, anterior superior iliac spine. Distal attachment, upper anterior tibia, just inferior medial to my tibial tuberosity. So you can see this, what is being said. And then what is its job? It flexes the thigh at the hip and the leg at the knee and externally rotates. Abducts thigh at hip. This is a weak muscle. It's also known as a talar muscle because the word sartorius is derived from sartor, and the sartor is talar. And then the nerve who controls this muscle is my femoral nerve, coming from my lumbar plexus. L2, 3, and 4 is the root value, and this is from the posterior division of my L2, 3, and 4 spinal nerves. I hope we are clear. Okay, let's look at the next muscle. So now we'll be looking at the quadriceps. I already explained quadra means 4. So we are looking at a muscle which is straight, and you can see this muscle is crossing my hip joint as well. So it is also bringing some action at my hip joint as well, along with the knee joint. It's a very powerful extensor of my knee, and this muscle is known as the rectus femoris. Rectus means straight. And a straight muscle who is located in the femoral region, that's my rectus femoris. And proximally, it's attached where you can see yourself, anterior superior iliac spine, and just above the acetabulum. So you can see that there are 2 attachments, 2 proximal attachments. They are easily visible to you. And distally it blends with the quadricep tendon, and which after enclosing this patella becomes, we call it patellar tendon, and then it goes to the tuberosity of my tibia bone. And then this is the action of my quadricep muscles. They are the main extensor of the knee. And the rectus femoris, as it crosses this hip joint, so that's why it is a flexor of my hip joint, but the primary flexors of my hip joint are iliopsoas muscle. What is this iliopsoas? Iliacus and psoas major muscle. Same nerve supply, we have already talked about it. Let's look at the second muscle. And the second muscle I'm talking 2 muscles here. We are looking at the vastus medialis. Proximally it's attached where you can read the lines. This is vastus lateralis, its proximal attachments. It's all visible to you on both the sides of my femur. Locations has been emphasized. And then distally, they are contributing to my quadricep tendon. And then the nerve supply and the action is main extensor of the knee. We talk about it, and same nerve supply. Going further, next, which we have not talked yet, and that is my vastus intermedius muscle. Now, how it looks different, because my rectus femoris was something like that, but see, rectus femoris was coming from above. And when I'll add the vastus medialis and lateralis, that will complete the whole picture. So this is coming from my front of my tibia, front of my femur. So you can see that anterior aspect of my femoral shaft is the proximal attachment. Distally it blends with the quadricep tendon, and same action and the nerve supply. So to summarize, quadriceps 4 muscles, Rectus femoris, vastus lateralis, vastus medialis, vastus intermedius. From these four muscles, only one muscle, which was rectus femoris, that was crossing my hip joint. The other three muscles, they are coming from the shaft of the femur. And all these four muscles, distally, they blend to make a quadriceps tendon, which encloses this patella, and from the patella to the radial, to the tibial tuberosity, this green thing is my ligamentum patellae. And if we tap here, we are looking at the level within the spinal cord is L2, 3, and 4. And all my quadriceps muscles, their primary job is bringing extension at the knee. Only my rectus femoris is also doing an additional job, a kind of a flexion at the hip, but the primary flexors of the hip are my iliacus and the psoas major muscle. That we need to be very clear about it. Sartorius is also there in this compartment, but it's a weak muscle. It's there, and there is another muscle which we'll be talking about it shortly. Next muscle is that, and that muscle is also learned with the anterior compartment lateral, but laterally we don't have any specific, so we'll discuss this here. So you're looking at this muscle, what I was talking. So this is my tensor fascia latae, and this muscle is proximally is coming. You can see that it's coming from my anterior superior iliac spine, and little bit from the lateral aspect of my ilium bone, and then its muscle is coming down, and it is distally attaching, where distally it's ending within my iliotibial tract, and this teal color stuff, which is, you can see this band, is my iliotibial tract, and it's going laterally to be placed to attach on the upper tibia. It's a very important factor for the lateral stability at my knee joint. And then what it is job, it primarily, this iliotibial tract is not formed by this tensor fascia latae muscle. It is formed by my gluteus maximus muscle. The job of this tensor fascia latae, it just tighten it up, and then it stabilizes the knee when we are bringing the extension at the knee joint. And the nerve who controls this tensor fascia latae muscle is superior gluteal nerve. This nerve is not a branch from my lumbar plexus. This is a branch from my sacral plexus. So now let's look at the femoral triangle. If you can see within this anterior medial aspect of the thigh, you can see the sartorius, the quadriceps, the rectus femoris, and then medially you can see these adductor muscles. And there at the top, we can see anterior superior iliac spine and pubic tubercle. It's all covered, but can you see this whitish, grayish white structure which is going obliquely? That is my inguinal ligament. This is my sartorius. There you can see the iliopsoas. This is my pectineus muscle. This is my adductor longus. There you are looking at the gracilis. Part of adductor magnus is also visible. So these are the surface landmarks, and then you can see the neurovascular bundle. And there you can see another structure. This is my spermatic cord. And then let's clean the stuff. Now we can see the similar structure. You are looking at the sartorius, adductor longus, pectineus, and iliopsoas tendon, iliacus and psoas major. And then rest is all covered, and this is, you can see, you can match it, same spermatic cord, and there you can see this inguinal ligament. So it's a triangle. So let's look for the boundaries of this triangle. Where is this triangle? You can see the upper boundary. Who is this number one? We have just talked about it. That's my inguinal ligament. So we can see that. Inguinal ligament is lower free border of this muscle. That is external oblique. You can see this muscle. And this folds upon here and is attached to the anterior superior iliac spine proximally, and distally is attached to the pubic tubercle. And this is my inguinal ligament that makes the base of my femoral triangle. And then what we have laterally, we have this muscle. We have talked about it. This is the drawing, and this is the real picture. So you can see the sartorius, which is located laterally. And then comes medially, this medial part of my triangle, and there's a muscle, adductor longus. So you can see this adductor longus on both the sides, and that's located, placed medially. And then the floor, we have already seen about these muscles. This is my pectineus, iliopsoas. So you can see this iliopsoas, and pectineus in both these images. Are we good so far? So these are the muscles who contribute in making the floor of this triangle. Roof will be skin, superficial fascia, and the structures who are running within my superficial fascia. And we had the great saphenous vein and its opening called saphenous opening. They are also present in the roof, along with other tiny structures. Are we good so far? So now femoral triangle has high clinical relevance. We use it for various purposes. Insertion of different catheters for various diagnostic procedures, cardiac stenting, other femoral excesses, blood draw, taking blood from the femoral artery, looking for femoral pulse. So these are the different the jobs which has been really connected to this area. It has high clinical significance. Another factor which is possible here, mostly in females, that having an hernia, and that we'll be discussing in the next slide as well. But this is a femoral hernia that is also connected to this femoral triangle. Going further, before going to the femoral hernia, let's talk about the contents of the femoral triangle. So again, the same drawing, but we have cut some of the muscles so you can see everything. And what we can see here, you can see very clearly the femoral nerve, and it's been splitting into its various branches. And the main job of my femoral nerve here is what? To supply the muscles. What muscles? The quadriceps muscles, plus the sartorius, plus the pectineus. All of them are innervated through these muscular branches from the femoral, and then it continues its journey as a sensory branch, which is heading towards this area, a very important area. We call it adductor canal or subsartorial canal. And then this was the most lateral structure. And then medial to it, we have the femoral artery. You can see its various branches. And then the most medial structure is the femoral vein. And then we had a canal here that is femoral canal. And you can see now very clearly the inguinal ligament. Inguinal ligament has different parts. And then you can see that this part of the inguinal ligament, we call it lacunar ligament. And then we have pectinate ligament. So these are the so many reflections of my same inguinal ligament. So let's put the things in accordance, how we can learn the contents of this femoral triangle. So we can have this another image where you can see this muscle, and these are the lower fibers of my epineurotic part of my external oblique muscle, and there you can see an opening. This is called superficial ring. We'll be learning about this structure in GI, not here. But here you can see all those which we have already talked about it: femoral artery, vein, and there's a canal. Look, the nerve is not enclosed in this. They are all enclosed in a fascial sleeve, and that is called femoral sheath, but the nerve is out of this because nerve has to stay out, and it's resting in front of this muscle. My pectineus muscle is being shown up here. So now let's look at, this is my femoral nerve. Then we have femoral artery, femoral vein, and then the femoral canal, which is empty, but it contains, can you see there is something inside? Normally this canal is empty, but there is one lymph node is here, and that is my lymph node of colloquoid. So lymph nodes are located here. Guys, sorry, this arrow has moved a little bit, but this arrow is indicating at this place. And there is a lymph node, and the name of this lymph node is colloquoid. If you know this name, it's okay. If you forget this name, it's fine. Nobody bothers with this. But only you know that femoral canal has a lymph node. So to make your life easy, use this formula mnemonics: Neville. How? For nerve, A for artery, V for vein, E for empty canal, and L for the lymph node. Is it easy? From lateral to medial. And then we talked about this adductor canal. We'll be talking about it in more details. So this adductor canal, you can see it has the femoral artery. After giving its different branches, it continues its journey to become popliteal, but not here. Femoral vein is ascending up, and then it's accompanied by a cutaneous branch of the femoral nerve. And then the similar picture, now you can see more schematic way, the femoral triangle, its base, the lateral wall, the medial wall, the femoral sheath, femoral canal. You can see this lymph node which has been traversing through In between is the femoral vein. Everything has its own compartment. And then we can see here the femoral artery. Then you can see the femoral nerve, which is resting in front of my iliopsoas. And this is in front. This is not enclosed in this femoral sheath. That's important. You need to know about that. So femoral sheath has only what? The empty canal, the femoral vein, and femoral artery. But femoral nerve is resting in front of this muscle, and this muscle is my iliopsoas. And we have seen this here. You can see it. Femoral ring. This ring is closed, but when there is an incident, those who are affected by femoral hernia, this ring becomes open, and that we'll be learning in our next slide. Now let's talk about femoral hernia. What is a hernia? Any idea? Hernia is a protrusion of an organ or a part of an organ from one body cavity to another body cavity through an opening which is abnormal to it. So now what we are seeing it, same drawing which we have seen before, but here you can see through this empty canal a loop of intestine has popped out, and that has, so what I have said, protrusion of an organ or a part of an organ, protrusion of a viscus or a part of a viscus from one cavity to another cavity through an opening which is not meant for this passage. So this is abnormal to this, but because of the raised intra-abdominal pressure, and who are the people where this canal opens up? Usually the affected people are female, and usually this is associated with childbirth and all that, and there is an angulation difference. So there are multiple factors. They predispose women to have more of this problem. And this femoral hernia, normally we can apply some pressure and it goes back. And then when there's an increase in intra-abdominal pressure, when you lift something, it pops out again in this space. The best thing is, if you notice a hernia, it's way better, get it treated, and treatment is no med, just a surgery. What we do, I will not go in those details, there's a lot, but there's lacunar ligament, and you can see the different parts of this inguinal ligament. It has to do with the things. We're not talking surgical techniques at the moment. So you can see just this is a femoral hernia, and when this hernia, it causes some disturbances, some unusual swelling under your skin, and it's a kind of a discomfort. But the worst thing is if it got stuck, then it's an emergency and we have to do surgery before the next sunrise. So inguinal ligament, I talk about it. Femoral ring, we have learned about this. Femoral sheath, and then this is the femoral hernia, and this is the detail if you want to read it. Okay guys, so let's talk about femoral artery. What is femoral artery? Look at my abdominal aorta. At the fourth lumbar vertebrae, it bifurcates into common iliacs. And common iliac, when it reaches the sacroiliac joint, here it divides into internal and external iliac. So external iliac continues down towards my lower limb. The moment external iliac artery, it gives its branches, but the moment it passes under this inguinal ligament, now it's no more called as external iliac, we call it femoral artery. Femoral artery, on its way down within my lower limb, it gives various branches, and there is one worth mentioning. It's a deep branch which is coming from a femoral artery, and that is my Arteria profunda femoris, or deep femoral artery. And you can see its perforating branches, and then it gives these perforating branches, and they go through the substance of my adductor magnus muscle and reach to supply. Their purpose is to supply the medial and the posterior compartment of my thigh. And then you can see from this perforating, the first perforating, we have some contributions, and these contributions are going upwards. And there you can also see from my profunda, we are looking at the lateral and medial circumflex femoral arteries, and these are really important. We have talked about these arteries within the description of the fracture neck of the femur. So now let's talk about, it's a continuation of external iliac artery, and where it's been located at the base of femoral triangle between the nerve and the vein, and then it begins its journey mid-inguinal point. We have talked about all these factors. But the worth mentioning, when it passes through this adductor hiatus, which is located at the distal part of my adductor magnus, the moment it goes through it, it reaches to the back. You can see it's visible, but now it's shown behind this bone. So now here we call it popliteal artery. Now let's look at this Arteria profunda femoris, a deep branch, and you can see its different perforating branches, and this is how it's communicating, and they are contributing in making the anastomosis around the knee. We will be learning about this concept in our further discussions. So main branch of femoral artery descend in the medial compartment of the thigh, and then it anastomoses with the branches of popliteal artery for making the anastomosis around the knee. And its worth mentioning branches are medial and lateral circumflex femoral arteries, and medial circumflex femoral artery is the main artery responsible to supply the head of the femur. That's really important and is highly associated when we talk about the fractures of femoral neck, especially the intercapsular fractures, and adult people, when they are affected, there is a fair enough chance of avascular necrosis. This stuff has been discussed earlier. Okay guys, so now we are looking at the superficial veins and we are looking at the great saphenous vein. You can see there are different color codings has been used to show you these different veins, and we can see this color is indicative of my deep veins and this green is indicative of my superficial within this image. But here you are just looking at the great and the small saphenous vein. You can see this journey. This great saphenous vein has really high clinical significance because this is the vein which is primarily used as venous grafts in cardiac bypass surgeries, and also we use it for saphenous venous cut down. I will explain this procedure in more detail when I'll be talking about clinical anatomy associated with my upper and lower limb. And then femoral nerve, we have talked about. It's a branch. It's coming from my lumbar plexus L2, 3 and 4 through the posterior divisions. So L2, 3 and 4. Guys, don't think I am only writing L2 and 4. L2 to L4, so it means 3 has to be there from the dorsal branches or the posterior branches. Largest branch, and it passes deep to the inguinal ligament, you can see in this image. And then it is present in the femoral triangle, lateral to the artery, we have seen it. Its motor branches, these are the muscular branches, and where are they going? They are primarily supplying all my anterior compartment muscles of the thigh. Who are they? The quadriceps. What are those quadriceps? You can see rectus femoris, vastus intermedius, vastus lateralis, vastus medialis, sartorius. And then it also supplies the iliacus and pectineus. Guys, it's not supplying my psoas major muscle. Pectineus is a very interesting muscle because we talk about this muscle with the anterior compartment. The nerve supplies from the anterior compartment, but its job is more with the adductors of the thigh at the hip joint. So at certain places, it's also been said this pectineus is also innervated by obturator nerve, but the prime nerve who controls my pectineus muscle is femoral nerve. There are variations. Don't get yourself in these discussions. So these are the motor branches, and the sensory branches from the femoral nerve, and worth mentioning is it has this last one, the saphenous branch. You remember when I was showing you this one which was running in this adductor canal, and it goes all the way down to your foot in the first. So we need to be good about it, that which part of the medial aspect of the knee, leg and the foot, this is the area of innervation. So if we have to test upon if someone has unfortunately fracture or some injury involving the thigh, or we are suspecting an injury to the femoral nerve, so easiest way without moving the leg, you can just look for the sensation areas for a saphenous nerve, and that tells the story. If sensory is intact, more likely the motor part will also be there. Are we good so far? Now let's summarize. We talk about these quadriceps and sartorius, and we have labeled all of them. I don't see there is any rocket science. This is a schematic picture, and this is all about the cutaneous veins of the lower limb, where we find, guys, this slide needs your little bit time. Read it, it's useful. A lot of useful information has been written here about bypass, cut down, varicose veins. A lot of things are here, and it's not about thigh, this is about the whole lower limb. And these are the tables which will help you to understand the muscles who are located in my anterior compartment of the thigh, and we have divided them as flexors of the hip joint, and then the second slide is the extensors of the knee. So these are all muscles who are present located within my anterior compartment of the thigh. Thank you very much.